Hello everybody, my name is Dr. Mike Blaney. I'm a general and bariatric surgeon at Live Healthy MD in Augusta, Georgia. And today we're going to talk about how much weight loss would I expect after weight loss surgery. 4 procedures that are routinely performed in the field of weight loss surgery is gastric band, sleeve gastrectomy, gastric bypass, and duodenal switch. All of these operations have various degrees of expected weight loss. In general, what I tell my patients is gastric band has the least amount of expected weight loss, followed by the sleeve, then followed by the gastric bypass, and lastly the duodenal switch, which has the best overall expected weight loss. The way we compare individuals to one another is what we call the percent excess weight loss. That might sound a little confusing, but let's make it easy for math purposes. If we're 200 pounds and our goal is to weigh 100 pounds, then we are 100 pounds overweight. So if we lose 100 pounds, then we've lost 100% of our excess weight. If we lose 50 pounds, we've lost 50% of our excess weight, and so on and so forth. So generally speaking, this is what I tell my patients. If an individual loses about 40% of their excess weight, so 40 pounds with the lap band, then I think that's pretty good weight loss results. Generally, if somebody's lost much more than that, they're probably too tight, they're probably experiencing significant reflux, regurgitation, and not eating in what I would consider to be a normal and social way, and oftentimes probably need to have fluid removed from their band. Fortunately, when this ultimately does happen, an individual oftentimes regains a significant amount of weight after having the band loosened. The weight loss results associated with the sleeve and the bypass are very similar. Expect most individuals to lose somewhere in the range of 60 to 80% of their excess weight. Now, why the wide range? Well, this depends in large part on where the individual is starting at, where their starting weight is. Much heavier individuals with body mass indices into the 50s and even over 60 will lose a lot of weight, but they will lose a smaller percentage of their excess weight. Individuals who start at a lower weight range when they have weight loss surgery, such as body mass indices, around 40, will many times lose close to 100% of their excess weight. So weight loss results obviously vary quite significantly from one individual to the next based on a number of different factors. And what I notice in my experience with the sleeve and the bypass, most patients will lose about 10% of their excess weight during the first 6 to 8 weeks. They will lose about 50% of their excess weight during the first 4 to 5 months after surgery, and then they'll lose the rest of that weight in the remaining year or so after the operation. Now, the duodenal switch has the best overall weight loss results, and most individuals will lose somewhere in the 70 to 90% excess weight loss range. And many times even 100% of their excess weight. So why don't we do this operation on everybody if it then has the best overall weight loss results? Well, most of the time for individuals who have a body mass index in the 40s and 50s, this operation is probably a little more aggressive than what they will need when they'll find satisfactory results with a sleeve or a bypass. So in general, I'd recommend the duodenal switch for our heavier patients whose body mass index is well into the 50s and over 60 range. So if you like this video, please subscribe and give us a thumbs up.